Welcome to McPlum, simple solutions served daily.
You start by identifying why the spaces exist. Once you know cause, you choose the right fix. Examine gap size and gum health and make sure no cavities or infection are present. If you feel pain, stop and see a dentist. Otherwise, floss gently and use an interdental brush to clear debris. Prepare a mirror, good light, and a ruler or phone photo to document gaps. Once done, you'll be ready to proceed with non-invasive options or discuss professional treatments. You now move into correcting the space itself. For minor gaps, composite bonding fills space quickly. The tooth is etched, bonded, and sculpted with resin and polished. This is reversible and fast. For larger or multiple gaps, choose Orthodontics. Clear aligners or braces move teeth predictably over months. Make sure to follow aligner wear time or brace adjustments. Inconsistent wear extends treatment. In either route, maintain impeccable hygiene so restorations or tooth movement aren't compromised, and schedule periodic checkups. You finish by refining function and retention. After bonding or orthodontics, adjust polish and occlusion, check contacts with floss and shim stock, and make small occlusal tweaks until comfortable. Once stable, place a retainer or bonded lingual wire to prevent relapse. This step preserves months of effort. If you experience sensitivity, uneven bite, or recurring gaps, return promptly. Early correction avoids larger problems. One key tip: if a composite chip or space reappears, don't DIY. See your provider for a controlled repair.
Thanks for watching. Stay juicy and subscribe.